Let's get an update now on the outbreak of the avian influenza disease, popularly known as bird flu. More than 10,000 birds in 7 farms in Greater Accra, Central and Volta regions were either killed or died naturally after contracting the virus almost a week ago. Veterinary officials have asked Ghanaians to practice personal hygiene and ensure they cook their food above 79 degrees Celsius if they have to consume poultry and poultry products. Joining us now for an update is Dr. Benjamin Kisisesu. He's veterinary doctor and a member of the Risk Communication. I'm grateful for your time, Doc.
Good afternoon to your viewers.
What has the Veterinary Services been doing since the outbreak?
Okay, I think first when it came, we gave a communique and we started detecting the first one. We had a sample from Accra, some farms in Accra, which I don't want to mention the name of the location. 8 July, the Central region, we had a sample from a farm on the 12th of July. Then the 14th of July, we also had some samples from Volta region. So these were the first 3 cases, the samples that we had that informed us to declare to the whole country that we have bird flu. Already, we are in the know that our neighboring countries, some have started having issues in detecting of this bird flu. So we're already on alert. And after getting this, we issued the alert, telling people that we want to contain this virus in these 3 regions. And so far, so good. As of this afternoon, we still don't have other regions joined. We still have these 3 regions. The only issue is that with Accra, we have had a little bit increase in the number of farms being affected. Some samples are being run as I speak to you. With regards to Volta regions too, a lot of work is also being done. There has been also an increase there with Central regions too. Yesterday, Central region, a team from Veterinary Services, that is happy to the acting director, Dr. Patrick Abaki, went there with the deputy MOFA, deputy minister for MOFA. We are happy to Honorable Yao, and they went to visit some of the farms in the Central region to assess. There was a farm that they've done the depopulation exercise and they've done a disinfection. And the farmer had the opportunity to let the minister to know actually what was on guard. It's not just a ESA, it's what has happened to this farmer. And the farmer, some of the farms, when the case started, with this virus, when it's being left, you're going to lose almost to 70 to 100% of your flock. But once we detect, by international standard, we want to contain, we need to stamp out the birds. Then we get them, we kill them, then we get them buried deep, disinfect, so that nobody gets to consume or get this thing to get to spread. So far, we have been on the ground. Accra too has done a great job. And Accra, out of the 15 farms, more than 8 farms they have visited, they have been able to depopulate. But lucky for us, look at the data I have. 90% of the birds that are normally in these farms already normally die naturally before we get there. And with this, after we are practicing One Health in Ghana, we have to collaborate with other people. So we collaborated with the Disease Control Office of the Ghana Health Service, and they have also asked for human samples, those who are in those farms, to be taken, so that we can test whether it has moved from these animals or these birds to humans. So far, samples from humans have also been taken, and we are waiting for results from the lab. So we are not losing that at all, making sure that we are able to secure all the boundaries regarding this bird flu. So also to let everybody know, by international standards, we sent samples to the reference lab in Canada, which we did. In the whole world, there are reference labs that are made for certain diseases. So we did send, and it has confirmed that yes, it is bird flu. And this the type that we are having is about 99.3% closer to the one that was detected in Nigeria. So it is either the source came from both Nigeria and Ghana had the same, had the source from the same place, or either it was by travel or somebody brought it from their side, or we all had it from one common country. So a lot of work is being done. But for now, from our reference lab, they are confirmed on international platform that yes, the bird flu that we are dealing with, and our strain is typically 99.3% closer to the type of virus in Nigeria. So we're still alert, making sure and advising farmers. What we have to all farms that as of now, as they have kept on doing, when they see an unusual death or they see any changing in the attitude or the characteristic of behavior of their birds, they see an unusual death rate, they get the veterinary service informed. So that samples or we come to investigate and see. The better we do all these things to help. We know that when it comes to this, they normally apply their money, investment that have been put into it. But as yesterday, the ministers made us aware, they are considering, and as it has done before, compensation. So we are hoping that some good news will come very soon for these farmers who have lost. And also, I encourage all farms that let us do it for Mother Ghana. When we are able to contain this virus, it's for the better future. If you have it and you do not report, or you don't make us aware, and after some time, we'll still have this outbreak occurring, and we don't know the next time what may happen. Maybe you did not record me this time around. After going for so much number of deaths, we lose a lot.
Dr.
So we
Sesu,
have to advise farms to make sure they didn't have it.
now, Dr. Sesu, looking at the work that you have done so far, how would you describe our situation? Is it still critical or mild?
Okay, for everything, we have not got into the critical phase because so far from the 8th July that we recorded in Greater Accra to 23rd, we have not been able to have this virus spread to more than the 3 regions. So we still have the control under the 3 regions. Volta is not increasing sharp in the central. It's Accra that we have a little bit, but things are being done. Yesterday, a lot of work being done. We hope next week with the update, we would be happy that we are able to have this issue down to the barest minimum. So far, a lot of resources have been pumped to. We still call for the necessary support, asking for the municipal assemblies, district assemblies who help in the stamping out and burying these affected birds to continue to help. And also the security personnel needs to help at various barriers, at various places, make sure birds that are entering to other regions, whether they have the permit, and those who do the inspection at the various markets, making sure that the right birds are there, need to continue. So far so good. We are alert and making sure that we are not less than our guard. Just this week, one citizen found a bird, a wild bird, lying somewhere in Containment. We are called to. We like to let everybody to know that these virus exist in the wild, and normally are being brought by migratory birds. So in your vicinity, when you see any bird lying anywhere, let the veterinary service be informed. We'll come for it and also make sure the necessary measures are put in place. So please, let's not forget, when we see any wild bird or any bird flying somewhere, let us get veterinary service informed. We would quickly let the wildlife division be aware and come to the situation to pick this bird and make sure. And also, we like to inform citizens to help. If you have any relative friends who are having these farms, we need to let them know what is happening, and they need to disinfect the biosecurity that we have taught them in the past time ago. That when people are entering their farms to come and buy eggs or whatever, bringing feed, they need to have disinfectant at their various entrances. And we like to advise that they should do well to avoid any visitor in this time. We do not know who's sending this virus to these places. And we ask them that they should not panic, just follow instructions and let us help the country to be able to deal with this outbreak.
There was an earlier warning. There was an earlier warning that we should not eat chicken or poultry products if we can. We should avoid it. Do you still stand by that advice?
No. If you go to a food and agriculture website, you go to OIE. This virus, when it started in 2007 in the world having this issue, they advise that with consumption, once well cooked, you don't have a problem. What we advise is those who handle that at the farm, when these birds, their droplets, when they farm, they are fed, they're swapping their wings and those things, they are likely to spread. So we ask that farmers should make sure that they provide PPEs, protective, they provide adequate protective clothing to their farm hands so that they get their nose covered, because this virus can spread. And when you handle any bird, you need to wash your hand. When you get to touch your eye, your nostril, or your mouth, you are likely to have this virus in. Once it is, well cooked, the problem becomes who handles it when killing and undressing. Those are the issues that we have. But they should also, this is not to let people to have it in mind that we encourage people to eat dead birds. No. We should have birds that were not dead, were doing well, that are fit for consumption, have been killed for us. But if you see any bird which is dead, we do not advise people to go for it and quickly prepare because we say we do not get it. No, we are also looking at the containment of this virus, and actually, in normal times, it's not safe for anyone to eat a dead bird. So we like to let the public also be aware that with the frozen meat that comes from other countries, and lucky last year that we had a ban on poultry products coming from Europe when they were facing the bird flu. Now we are able to have them. Let us remember that we have veterinary service personnel at the various harbour, at the various ports that make sure that these meat that enter the country are inspected. So once they are declared that they are good for consumption, we do. Last year when the ban came, samples were being came to the lab even to test whether there's a way of COVID being with it as studies were going on. So all the samples that came, lucky we didn't have anyone tested for COVID and also bird flu. So we should not be alarmed. Let us follow the precautionary measures that we have put in place. That is one, do not accept any bird, eggs, or manure from other farms. Farmers should keep to their farms. They should not go visiting other farms. Now, we should wash hands thoroughly with soap and water immediately after handling birds. So this goes to the farm hands, goes to the market. Anytime you touch a bird, even in your own house, if you have a poultry bird or you have a duck, let us be mindful that with this case, we had turkey, we had ducks, we had guinea fowl who were affected. Okay. And most of them happen to be those who keep them in Accra. So let us not think about only the poultry bird. Ducks were also affected. We have turkeys, guinea fowl. So anyone keeping such animals need to make sure anytime he handles, washing his or her hands, we should confine our birds away from other animals or wild. Most people in their various houses have left these birds around. If possible, in this time, they should get an coop and get them confined to one place. Also, we ask that they should continue to clean their farm and poultry equipment regularly. We ask to burn or bury dead birds and waste away from the farm hands. So when these we found out that birds are dying, we quickly report to the veterinary service. They will come and handle these birds that's happening. And you say that who handle those birds, make sure they wash their hands after that. We ask that you keep your nose and mouth covered with clean clothes or masks or nose guard when slaughtering these birds. As I said earlier on, those who handle working these farms need to, and those are working the slaughterhouse and dealing with birds need to make sure they have personal protective clothing.